All right, folks, thanks for joining us today. Welcome to Mind Locked. I'm here with Abby. What's happening?
Not much. Just got home from work. Good old day of Chick-fil-A.
Oh, how many spicy chickens you get rid of today?
Oh my goodness, so many. I don't even know. We were slammed. It was insane. But I told one of my coworkers about our mental health podcast, getting the word out there.
Right on.
And I was talking to him about it, and I said, "Yeah, we have a mental health awareness podcast with my school." And he goes, "Oh, what?" Like he'd never heard of mental health awareness before. I was like, "Mental health?" He goes, "Oh, I thought you said a mental arthritis podcast." I was like, "No, that's not what I said." But that's funny because I feel like sometimes I have that when like my brain freezes or something.
Mental arthritis, absolutely.
Yeah.
Cramped up.
Yeah, I was like, okay, sure.
That's how I feel listening to myself on these things the next day. Like, oh.
I was not kidding when I told you I listened to it for the first time, and I was like, yeah. Then I emailed like the CIA or FBI and told them they could use it for torture. 'Cause that's what it was for me, torture. Listening to it, I was like, do I really sound like that? I'm never gonna speak again. Great.
Well, everybody's told me that they love you on this thing, so
Oh, great.
I don't expect them to give you a call back from the FBI anytime soon, but
I feel like we don't even want it. You can keep it.
why are you torturing us?
Yeah.
Oh, yeah, I couldn't tell you the last time I ate Chick-fil-A. It seems like it's an impossible drive-through line to even manage. Like y'all got like 7 people out there with iPads running around. Like,
Well, here's the cool thing. The one I work at doesn't have a drive-through. Yeah, it's inside of Park Meadows Mall. So I've like literally never worked a drive-through. So I have no idea what it's like. Yeah, we
well,
don't have to bathrooms, nothing.
that's probably the place to go get it then.
Oh yeah.
I've been eating a lot of Annie Ann's pretzels. Sometimes I just get bored and I like go to walk around Dick's just to see what's not new anymore. And
Yeah.
Annie Ann's is right around the corner, so I make a stop in there. It's connected to the Cinnabon. And I actually went there earlier, I think it was last weekend, like last Saturday. And I was like, oh, I'm going to go get a Cinnabon, pick up a coffee on the way home. Came out of there with a pretzel and cheese, like no care in the world. It was like 9 in the morning, 10 in the morning, whatever time they open, crushing a pretzel and cheese.
You know, there's a Wetzel's Pretzels on the second floor, right?
I've never had a Wetzel's. I think we're talking about different malls, actually.
Oh, that might be it. I was like, I've never seen one there, but okay.
I like to keep my mall undisclosed. There's only like 4 people ever in there. But 2 of those 4 people have been ACC students, right? On the weekend, I'm rolling through and they're like, yo.
You're like, dang it. I have to do a new mall now.
All the places. No, it's all right. They were always nice and cordial about it. So today we're talking about drugs and alcohol.
My favorite 2 topics.
I mean, you throw rock and roll in there and you've got yourself a movie.
Yeah, there you go.
But this was an interesting concept for me. You know, I moved out here from the East Coast, and at the time there was no, legalized cannabis or anything like that. At most, we had decriminalized. So, working in student conduct prior to moving out here, right, kind of set my mindset as to how you educate and how you approach certain things. And, I think for a while now, we've been moved towards the prevention aspect rather than the whole just don't do it abstinence approach.
Right.
But I had never really thought of it in that mindset when it came to cannabis because it was still such a high stigma thing back east at the time, right? So it was nice to get the input of these ladies that came on the show with us and got to dive a little deeper into their background and knowledge with it.
I agree.
All right, well, let's send it on over here to the interview. All right, so thanks everybody for joining us. With me today to talk about alcohol and other drugs are my good friends from NASPA's CADE team. We have Maureen DeChico, we have Emma Spalding, and Rita O'Connell. So these ladies are responsible for training student affairs professionals on topics around substance abuse, alcohol, and other drugs. They're the ones that really try to keep us informed and help us find new trends and best practices to, program when it comes to students. So welcome, ladies. Thanks for joining us today.
Thanks for having us.
Thank
you.
Thank you.
Well, the first thing I'd like to ask you is what makes you, or what inspired you to do this work in the first place? Like, how did you end up where you're at?
I think what inspired me is my background in public health. So I got my master's in public health, and during my education there, my time at the program, I did a lot of work with college students. And so I think this is a population that there's not that much resources, or they're not served as well compared to all the other, like the youth and adults. And so this is a much needed population. And so I think that's what drives me to this work, is because there is such need.
My first entry into alcohol and other drug prevention was actually when I was a college student myself. I went to a campus that had a long orientation program. It was 9 days. And one of the days, one of the evenings, we had a speaker come and talk about alcohol and other drugs. His name is Jason Kilmer. He does a lot of work in this field. And he's a really great speaker. And so he actually made listening to and hearing an adult talk about alcohol and other drugs very interesting and not shaming. And so I had to go my first year on campus, but then I became a student leader in orientation, and I opted in to go every year because it was so interesting to hear about his research with alcohol and cannabis. And so that was really my entry point into this work.
I think for me, being a psych undergrad major, this work really bridges the gap between psych and then higher education. And with the higher ed field, we don't really talk about it a lot, especially in the curriculum. So for me, kind of learning through this work is really helping me move forward into that higher education professional world as well too.
Well, I know for me, it's been, a few years since I've been in school, right, as an undergrad and things like that. How do you guys see education around alcohol and other drugs changing maybe over the last 10 to 15 years or so?
So I think in our conversations we've had before this, Maureen and Emma and I had kind of talked about the abstinence approach to now moving more into a harm reduction approach. So abstinence being completely straying away from all mind-altering substances and recovery, and thinking of it as more of a punitive kind of program. And I always like to think of the DARE program, which is drug abuse resistance education, which is pretty funny because my dad was actually a DARE officer back in the day. So, I mean, that program really sought to prevent all use of controlled substances, where now we're seeing more of a harm reduction approach, where it's more so about minimizing and reducing those harmful effects that are associated with substance use. So kind of shifting that lens from abstinence to harm reduction.
Yeah. Well, I think now with the legalization of cannabis, in Colorado, a lot more programs or colleges or campuses are more trying to address different substances. So before there was a lot of focus on alcohol prevention, and it has kind of moved towards including cannabis and prescription drugs, as well as tobacco prevention. So there has been that shift. Cannabis is a little bit more complicated since potency levels kind of vary depending on how they decide to consume cannabis. And there isn't really a standard as there is a standard drink for alcohol.
The other thing I would add is that there are new substances and products on the market. 10, 15 years ago, e-cigarettes were a lot less prevalent, and they looked different than the products that are out there today. We think about Juul as its own noun and verb and its own category of thing. And, that just came on the market just a little over 5 years ago. And even in the past year, since the flavor ban on e-cigarette flavors has passed, Puff Bar has been introduced to the market. So, it's ever evolving in the education that is needed around the different methods of use for these products.
Yeah, things have definitely changed from, the days of, the movies I can reference are Dazed and Confused and Animal House and stuff like that, right? The simpler times of your partying tactics or whatever. Now there's just so many different things out there for students that I think, opening that conversation has been a good approach. I always, back to the Animal House thing, I always wonder why, why college comes with such a stigma of you're supposed to party, or you're supposed to do this, you're supposed to do that. What do you relate to intertwining that into our American culture system? Do you think it's movies, pop culture? Do you think it's something beyond that?
Yeah, I think that there is a huge media influence, like you're saying. There's different perceptions that happen in movies, but I also think there's the social media shift, right? You can see your peers on social media partying. Your peers are less likely to post a picture of them studying in the library or choosing to go camping on the weekend than they are of hanging out with folks and maybe consuming different substances. I also think that parents had different access to substances and different types of substances than the students going to college now. And so they may not be having those conversations with their parents or other family members, not even just their parents, before they're entering higher education.
Rita and I are just staring at each other like, who's going next?
I don't have much to add.
But yeah, I feel like Emma covered most of it. I think, just thinking about like access, with legalization, youth are more able to get access to like cannabis and other drugs that they weren't before. And so just thinking about that and how to target those students who are under 21.
Yeah, and I guess to kind of add on to what Emma said also, and what you said, Brian, it's kind of been entwined in the culture for as long as we can remember. Like, it's not just what we know in the culture nowadays with like social media and whatnot, but like back in our parents' days, it would have been in like movies and TV shows, and just generation to generation, I think it's kind of built up on itself, just being entwined in that culture.
It's interesting too that a lot of times, talking to my parents about their experience in high school or college or whatever, and where I grew up in Pennsylvania, the drinking age was actually 18 for them, right? So former, higher up VPs and things at other institutions that I've worked at used to tell us stories on, move-in day when you're working 24 hours straight and you're gassed and you got no energy left. And he'd just come up and tell you a goofy story to try to, boost your energy level. And I remember him telling me one time, he said, on orientation, they used to provide kegs for the freshmen. And everybody in our office kind of like threw our head, right? Because we're in a conduct office. Like, what is, and he was just like, yeah, it was a normal thing. It was, everybody was able to drink. So it wasn't necessarily, I don't want to call it not an issue, but it was a different kind of issue maybe than what we're facing now. So I think a lot of times have influenced where we're going to, but you guys were mentioning how cannabis has changed the culture as well for us. Now, myself moving to Colorado from the East Coast, there's a lot of places that have yet to legalize marijuana, let alone decriminalize it, right? So that kind of changed the narrative for me as far as the approach that we take in education and things with that. So with so much information and misinformation out there, what can we do to limit the risks of the impacts by using these substances?
So I think kind of just having an understanding that it affects everyone differently. So you have to kind of know what you're getting yourself into. So there's obviously different quantities, different potencies, different strains, different methods of consumption for cannabis, and they all impact the user differently. And they all impact the body and the brain differently. So, and I know Emma and Maureen can probably speak to this a little bit more than I can. But I mean, I do really think it's important to kind of do your research before going into it, just to know the potential effects that you might be experiencing.
Yeah, and like Rita said, it really depends on like the methodology of use and the potency levels. If you are using edibles, it's probably best to not eat all of them at once, but just to go slow, because it takes a while for you to start feeling the effects. Whereas like with smoking, you'll feel the effects immediately. So it's good to think about those different ways of consuming cannabis, but also thinking about like its different health effects. And I'll throw it over to Emma to talk about some health effects that it may have.
So one of the things I want to add about potency and methods of use, especially for anyone that's over 21 and can go purchase this legally, we're in Colorado, we're fortunate enough to have these bud tenders that are really knowledgeable about the products and how the percentage of THC in them, and can really help you understand what you're purchasing, because that potency has gone up so much more than if our parents were consuming weed and just smoking joints, that has a lot less potency. So that's something to consider. But in terms of health impacts, a lot of cannabis is taken as smoke. And so that has respiratory impacts. Anytime you're putting something into your lungs, it can irritate them. So thinking about, those what chemicals are going in there if you're using a vape pen or dabbing, but also just the weed that might be coming in with a joint or a bong or something like that. Also any secondhand smoke, lots of students choose not to use. And so thinking about those around you and if they're using, what impacts that is having on you as well. We know the stereotypical side effect is appetite, that it gives you the munchies. That sometimes happens for folks, but sometimes it can decrease your appetite too. It just totally depends on the individual. And then, most people are consuming cannabis to get high. And so that psychosocial effect of that high is usually a positive side effect that folks are looking for, but also it can be negative if you're consuming on a daily basis and it's leading to some hallucination. Wow, I can't say it. You know what I mean? Or some paranoia. So yeah, that's some of the health effects just to consider. And then also, not everyone chooses to use it. In the state of Colorado, we found with college students that about half of students, 47.5%, have never used cannabis. So there's lots of folks that also are opting out. You're not alone if you choose to do that as well.
Yeah.
And I think those numbers are accurate with our institution numbers as well from our survey that we did last year. Maureen, did you have something to add to that?
Oh yeah, I was just gonna add, we've also heard students mixing substances, so using cannabis as a downer, whereas they're using ADHD medications or alcohol during partying. And so that could lead to some crossfading and some more impairments and more health effects, kind of like what Emma said. So yeah, just wanted to bring that up.
Well, I don't know if you guys saw this, and I don't know if it was fake news that I found or if it was real news. It came up on my Apple thing, right, when you swipe to the left there. But, up in Canada, they've recently legalized cannabis nationally, right? And there was a study that apparently some chemists or, whatever you call these people, found a link or something in particular in the cannabis that was actually stopping COVID from getting into your respiratory system. And so, Emma, when you brought up the respiratory effects, it kind of reminded me that I had read that. I never saw a follow-up, which leads me to believe maybe it was just a 1 out of a billion kind of situation. But, there were a lot of different, memes and things going around about how, tobacco is going to prevent you from getting COVID because, whatever, the tar blocks this or, just whatever people make up. So it's pretty interesting. But had any of you seen that or?
I haven't seen the cannabis one, but I've heard people talk about tobacco.
Yeah, I've seen some preliminary research out there. People are still figuring out COVID's so new. But just thinking about what we know of anytime someone's inhaling smoke, it's irritating the lungs. We all know the stereotypical coughing when you're smoking a joint or something like that. So that's always irritating the lungs. And we know that it puts you at risk for other respiratory things. So I think the jury's still out on COVID, but my guess would be that it doesn't help.
Well, whether it turns out to be a good situation or a bad situation, have you guys seen some other dangers or unintended consequences with the legalization of marijuana in Colorado?
Yeah. So one of the things that I think was an unintended consequence was trying to figure out the driving under the influence and determining the limit for that. One of the reasons that this happened was because of the way the Colorado legalization happened. It was a voters amendment to the state constitution. So it was the 2012 Colorado Marijuana Legalization Initiative, or Amendment 64. And so it was brought forth not through the legislature, but by the people. And so they had to get votes to get it on the ballot. But part of this meant that it wasn't totally comprehensive. It didn't go through all of the regulations that needed to be put in place for it to be legalized. So it took a little while for the state to figure out the driving limit to consuming. And so this is also different than other states who have legalized cannabis because they've all been passed differently with different regulations in every state, which is one of the reasons why it's not allowed to transport cannabis into other legal states, even if they're next to one another, is because all of the states have different laws. And Brian, you mentioned earlier about legalization versus decriminalization. I think Colorado was the first state to legalize cannabis. And so decriminalization, or, getting rid of past records of folks that had been caught with marijuana and prosecuted for that, was not part of it. Whereas states that are legalizing now, there's usually a push from the population to get those as part of legalization. And then, there's different rules with medical cannabis as well. So there's those three different buckets of how these are, legalized in states.
Yeah, and some other consequences is just like educating our out-of-state students as well as international students. And so since cannabis is still federally illegal, it can impact one's financial aid as well as their visas to get here and study. But also for out-of-state students, they're not as well known or well versed about cannabis and its effects, as well as the laws and regulations in Colorado. And so, you can't consume in public places, you can't consume on a college campus, you can't do it at a national park. And so just trying to educate students about that would be another good thing to do to kind of address some of these unknown for when cannabis passed.
Yeah, and I think another unintended consequence as well is the access part of things. So thinking back to alcohol consumption. So in states, alcohol consumption age is 21. And a lot of individuals would have their, older siblings or friends or whoever go out and purchase that alcohol for them so that they could then consume it as an underage person. And I think we're kind of seeing that as well in states where cannabis is legal as well. So just having kind of that more access to it, because friends, family, whoever it may be, can get that access for them. And then underage individuals are consuming that. And I guess just to kind of bridge off of that as well, there is a Healthy Kids Colorado survey, which kind of looks at health impacts for kids under the age of 18. And in 2017, it was reported that in Colorado in the past 30 days, 19.4% reported using marijuana. And this is actually pretty in line with the national use. So it's interesting to kind of look at that with the legalization.
Do you guys know if those numbers have changed at all during the COVID situation with isolation and people trying to, combat with mental health? And obviously substance abuse becomes an interesting demon during that, right? Liquor stores, they tried to initially say that liquor stores and dispensaries were not essential, and half the world blew up, and they changed that within the hour. So we know it's happening, but have you guys seen any trends ticking in a negative way with that, or is it maybe too early to tell?
One of the things that's not particularly Colorado related, but nationally, is particularly with alcohol, the ability to take things to go or delivery services has increased during the pandemic. And so changes in local and state rules around that have shifted to be a little more lenient. And so that is an interesting trend. And I think it will have impacts because of the lack of restrictions or oversight on making sure that the people that are getting it delivered are over 21, that sort of thing. I also think that in Colorado, it's working, and Maureen can maybe talk to this about this a little bit more, but we're working on passing delivery in different areas, first for medical cannabis and then for adult use. And so that will have impacts as well, but that didn't go through before COVID. Otherwise, I think we would see some interesting data around that as well.
Yeah, I agree. I feel like I think if COVID still lasts until like the next year when this bill is supposed to go through, I feel like a lot more people will be using this delivery service. But if it doesn't, there's also another bill for like hospitality lounges where people can consume on site, or, they'll take their cannabis to this place and consume it, or they'll just purchase and consume there. And so we also may see some more changes and more an uptick in use due to all of these bills.
Well, I noticed, right after COVID happened, there was a dispensary next to the grocery store that I shop at, and I was driving there. And have any of you seen the movie The Circle?
I don't think so, but it sounds familiar.
So it's this crazy movie where they like trap a bunch of people in this room and they all have to stand on this dot. And if you move from the dot, they randomly select somebody in the room to kill. And your job is to consensus pick who that person you're going to sacrifice is, and they struggle, right? But the idea is they can't move from this dot, and they're all stuck on their space. And so as I'm driving to the grocery store, I look over to the dispensary, and there's like 100 people in the parking lot all standing on their dot, right? Masks on, just like not moving. And all I could think about was like, oh, which one are they going to pick? Which one's going down? But, it was baffling that was maybe day 2, right? So I'm sure it was probably the panic stock up mode that was really driving that. But that made me a little bit concerned for, our students that we're dealing with and what they may be going through during all that on top of all of their other personal issues. So let's switch this up a little bit and go to, like a reflection here. What is something that you wish you knew in college that you know now?
So one thing I wish I knew, so I told you earlier that I was learning about alcohol and other drugs during orientation of school. So I learned some information around it, which helped a little bit. But I went to school in Washington. And so while I was in college, both Colorado and Washington legalized cannabis. And so the perception I had then was that everyone was using cannabis, all of my peers. And so I wish I knew that that was a perception and the actual use was much lower, because I felt that my habits were out of line with my peers. And so that was a little strange to like not want to consume cannabis and thinking that everyone around me was. And so, some social norming or some education from the campus professionals would have helped me feel a little bit more comfortable with whatever I chose with my own habits.
Yeah, I went to school in California, and they required us to take alcohol EDU, but I did not, I paid attention to it, but I just forgot it. And so I think when I would be out with friends, I didn't think about the different symptoms of alcohol poisoning and overdose, as well as different steps to approach someone if they seem drunk or out of it, how to help them. So I think it would have been helpful for me to do some sort of bystander training. But yeah, I feel like that was something that I wish I learned, because I eventually had a friend who had to go to the hospital for alcohol poisoning. And if I could help her out before or intervened, that probably could have been stopped.
For me, so I did my undergrad in Wisconsin, and cannabis is still not legal there. So I guess looking back, I wish I had known more about alcohol use when I was in college, and particularly BAC. I mean, now with this educational platform, I know a lot about that, but at the time I really didn't. So being aware that my sex, my weight, what kind of alcohol I'm drinking, and the amount of time that I'm consuming this alcohol really affects what's in my body and how I'm feeling. I think it would have been great to know that instead of just, being like, oh, here's one drink and then here's another drink, and kind of just like ticking it off and being like, okay, that's fine. I'm keeping track. And just being a little bit more aware in that sense about alcohol consumption, I think could have been really helpful. And like Maureen, I mean, I also took alcohol at EDU, but I think a lot of times you take it as a freshman coming in and then it's just out the window. So something to keep with you, I think would be great.
From my experience, I think a lot of my takeaway is getting away from understanding that you're supposed to do something, right? Like whether it's a tradition or whatever. Now, I don't believe in every tradition that's ever happened, right? But at the same time, I do value tradition. So there's that coming of age or that coming of guard where you're supposed to do these things and like discover who you are and make mistakes to get better, which I'm sure that we all have in some capacity, some maybe on a different scale. But for me, it was understanding that like we're all out there partying and everybody has a different reason as to why they're partying, right? Some people are out there just because they're bored and they need to entertain themselves. Some of them are coping with different things, right? And maybe having a better perspective now as to why people choose to do different things would have been beneficial, because a lot of my friends, teammates, and just fellow classmates that you'd see on random weekends would make decisions, and you would just kind of not really forget why they're doing it, but you would maybe put it from your own perspective, like, it's Thursday night, there's nothing else to do. But what you really didn't know is there's something else going on with that person. And it may not hit within that 4 years or those 2 years that you're there or whatever it is, but you end up at reunions or alumni functions of any kind, and you maybe hear a story through the grapevine, or there's a couple people that aren't there and you find out why. And knowing that at one point you had an opportunity to maybe make a bigger impact, or just say something that would change perspective for a moment, that's kind of where I would come from, is like, okay, you're going to make your choices, you're going to do what you do, but understand that maybe people aren't doing it for the same reason as you are, and there's a way to go about that. So I've had a great time chatting with you ladies today. Are there any last little tidbits that you want to throw out here before we go? Any other stories you want to share? Or I see some smiles, but I can't hear your giggles.
I was like, I don't really have any other stories. I was like, Rita, Emma.
I was just going to add that, we talked a lot about cannabis and legalization in Colorado and knowing what is true information and misinformation. And I'll just say that, like, it's ever evolving. There's still research being done. It's really interesting because federally cannabis isn't legal. The research that can be done is with cannabis that has such a low potency compared to what's on the market in cannabis legal states. And so, there is a lot of anecdotal stuff out there, but in terms of what the real impacts of cannabis are, it really is still being studied. And so I think it really depends on individual use and what works best for individuals if they choose to use.
I think we've all said this in one form or another throughout our time together, but it really is your choice and it's up to you if you want to use or not. So I think understanding that and, maybe not succumbing to those social norms or whatever you think it is based on media perception. It's really nice to look at the data and be like, okay, I'm not the only one that's not using. And knowing that you're not the only one amongst your peers.
Brian, are there any resources that you could highlight that would be helpful for students if they wanted to learn more about substances?
Well, our Dean of Students website has a full gauntlet of lists. You guys are actually, I think, on our list as well, to be honest with you. But on that point, this just reminded me when you were talking about international students coming and not understanding cannabis. We have these awesome pamphlets that we got from you guys, right? The tips from the bud tender. I don't remember what her name was, Jenny or
Meg.
Meg the bartender. And every time I look at those and, I think about nobody comes here with an understanding, right? A lot of people do travel here, and I'm looking at these pamphlets and it's telling you how to do this, where you can, where you can't. I think they would be tremendous resources at like the airport, or maybe a train station where people are coming in, because, I know a lot of people come here and they think they're going to overindulge and do all these things, and then they find themselves stuck in a hotel where they're kind of like, well, what am I doing? Or they buy more than they can consume and try to consume it all and put themselves at a higher risk. So I know that's not the question you asked me, but do you have any in particular that you would recommend?
I feel like we've given you some of the resources that we have, but Emma, I know you're supposed to say something.
The state has a lot of resources that you just mentioned, from Meg the Bud Tender, especially if you're over 21 and can purchase legally. They have a lot of resources on how to use different methods of use, all of that.
Yeah, Brian. And if you wanted to get more pamphlets too from the state, you could go to I think it's like cohealthresources.org, and that's where you could get all the Meg the Bud Tender information.
Perfect. Those are always a big hit at the table. Students love to pick those up, and even the students that maybe partake a little more than the average, they always seem to find something on there that they didn't know. So I think it's a tremendous resource, and appreciate that you guys provided that for us.
Yeah, thank you.
I do have to say, Emma, you said when you were in college they legalized cannabis. When I was in college, they were just signing petitions to decriminalize it. So showing my age slightly there, but I do remember that, the SSDP Club. That was the first table I walked by at my freshman fair. It was the Students for Sensible Drug Policy. And really what they were trying to do was decriminalize it so that you don't lose your financial aid if you make a poor decision. So fortunately now people can maintain their financial aid for the most part, in most states at least, and educate themselves and maybe have a better future had they just been shut out of the system. So thank you all again for coming today and participating with me. I hope we can do this again in the future. I know you guys are passionate about your job and have done tremendous things for me over the last 2 years. So thank you for that.
Thanks for having us, Brian.
Yeah, thank you.
Thank you, Brian.
So, when we talk about alcohol and other drugs, a lot of times I think we imagine the big four-year institution in a lot of these prevention aspects and these conferences and things that I go to, mostly because they have residence halls where people live and, have parties on the weekends and all these things happen. For us at ACC, we're a non-residential campus, which doesn't mean that these things don't happen. It just means that we're not necessarily as in touch with what's going on. So now, like, for instance, Abby, I see you at school, going to class, whatever, in the hallways, but then you disappear and then I don't see you until you come to class next time.
Right.
At a 4-year, if you're living on campus, I'm probably going to see you getting dolled up and walking down into the senior housing to have a party later on in the night, or, like, everybody's constantly moving about in the cafeteria or all these different spaces. So, it's easier to maybe establish that connection and understand, like, this person might be at risk of, overindulging or things like that, because you see their habits and you see them on a regular basis to know that something's out of character. Whereas, non-residentially, I'm really just basing that on the social cues that I see in that quick moment back and forth. So I think that's one of those areas that bystander aspect of, what can friends do for each other, and how do we make sure that we know enough about these topics to prevent each other from putting ourselves at risk.
Absolutely. I mean, you're right. Like, I don't live on campus, obviously, at ACC, but I think there are a lot of risks to, smoking marijuana that a lot of people don't realize. I used to work in a couple emergency departments, actually, and we'd have quite a few people who'd come in, heavy smokers, 420, and they'd be like, I had no idea that these were such heavy side effects to smoking weed every day. And we're like, yeah, like, I feel like this should be common knowledge. If you smoke weed every day, it's gonna ruin the inside of your stomach and you're gonna be dry heaving 24/7, then come and see us and be like, whoa, what happened to my body? And, like, there's just this basic knowledge that I feel like everyone should know if you're gonna do it. But a lot of people are really uneducated about it, I'd say. Other than, oh, it feels great, it's, cheaper on this side, or you do the fake stuff or whatnot.
Well, it might be one of the benefits of legalization, to be honest, is people may be less inclined to lie to their physicians, right? Now that it's, it's legal. You don't have to go to your doctor. And when they ask, do you drink, do you smoke, do you do this, do you do that? A lot of people won't say, right? They just want to keep their thing to themselves and kind of, not spill their beans. But when it's, more accepted and that stigma maybe goes away a little bit and people say like, oh yeah, I do smoke weed a lot, and 5 blunts a day or whatever their capacity is. I remember I was listening to a news story in Boston a couple of years ago where, they found out that this person was coming in and all of their symptoms pointed towards like liver failure, right? Or maybe it was kidney. I don't remember exactly what it was, but on the news, they were saying that, it's one of those cases where if you put this person in a hot shower, it's going to shut down their organ and it's not going to be good for them. But because this person was very open about their cannabis use, they were able to realize that it had something to do with that. So they put him in a hot shower, right? And it ended up, subduing his reaction or whatever it was. So I think the bright side was that we're going to get some good, maybe health and scientific data out of some of that transparency that comes with it. But it's going to be a double-edged sword because to get that information, right, you have to find it out the hard way sometimes. So hopefully we can just do our part to educate people on the risks associated with their choices. We're not your parents. We're not going to tell you what to do, what not to do, but we're going to educate you to the best point that we can, that when you make a decision that you can't blame it on somebody else or not knowing, do the research, make smart choices. So
yeah, for sure. There's many good stories with weed in the ER.
I mean, changing behavior is hard. I've seen it working in student conduct, right? You hope that you get through to people and that, you can educate them enough to make a better decision, but it doesn't always work that way. Sometimes you have to, get your boots stuck in the ground a little bit before you can realize that, maybe I shouldn't walk there.
Yeah, that's a good thing about like hospitals and 911 and nurses is they're going to be there to help you out if you're willing to reach out and ask for help. If you ate that edible and then you realize, oh shoot, like I do not feel good, this feels wrong, go get help. There's no shame in it. It's like you said, to get your boots stuck in the ground, okay, I don't want to go that path anymore, try something else.
Cool. Well, I think that wraps up this episode of Mind Locked. So yeah, we've got some great shows still to come. I'm not going to spill the beans and spoil our next guest, so you'll just have to tune in and see what we got stored for you.
You're definitely